You hear us talk about hospitals nearing capacity statewide because of COVID patients, along with other folks who are in the hospital. There's still fewer than 100 ICU beds available right now. Each hospital has staff responsible for juggling patients, beds, rooms. Our Marshall Zellinger takes us inside Denver Health's control room.
It certainly doesn't have the same sound or look as air traffic control.
ACC, Michael speaking.
From this board, we can see every single bed, every single patient, anywhere within the walls of Denver Health.
Citing patient privacy reasons, Denver Health provided this footage instead of letting us inside the room that acts the same as air traffic control, but for patients instead of planes.
We know everything that's going on at any given time, or we should.
Justin Mares is the nurse manager for Denver Health's ACC, Administrative Clinical Coordinators.
We as administrative clinical coordinators figure out what the appropriate bed is for them, what the appropriate unit is, where we have resources for that patient, where we have physical space for that patient, and where we have specialty services for that patient.
When we tell you how many ICU beds are available, it's based on a once-a-day snapshot updated by the State Health Department. Today's update shows 94 empty ICU beds, but all hospitals, like Denver Health, know the number in real time. ICU beds are just one of the columns on the screen showing where patients are and where future patients can be.
Especially during COVID, that has all been ramped up. We have an emergency management department that we report up through. We give them our current bed availability, and other facilities are doing the same, and that all gets reported at a state level.
And the reporting internally is a bit old school.
A lot of what we do now is done via phone call. I'll get a phone call from our transfer center, I'll get a phone call from our ED, I'll get a phone call from various people all vying for these same kinds of resources.
To ease the reliance on phone calls, Denver Health is building out this room to put more decision makers in the same area, with COVID safety in mind.
Our goal with our patient flow center is that we're going to get everybody into one space to get rooms cleaned and turned over so that we can get more patients into the inpatient beds.
Now, each hospital can only see its own patient flow. They report to the state their bed capacity, and if they need immediate space, they contact what's known as the Combined Hospital Transfer Center, and under an executive order by the governor, that transfer center can reach out to other hospitals and find a taker for a patient and send that patient to the facility without the patient's consent, but the hospital knows they're coming and knows that they can care for them.
And the insurance or the state is going to cover that cost. People always ask us this. So we are at crisis standards of care for staffing. We do not have those emergency rules in for patient care. That's the point where you get people yelling about like rationing care. You have people yelling about death panels and stuff like that.
And there are two separate things. When I was asking questions about this story, I was made clear. No, staffing is one thing where you can loosen the rules for staff and who can do what. Patients, that's when that room could be like, okay, who's more dire? We got to get that person in the bed next.
That's when it becomes what we worried about during the pandemic. Do we have enough ventilators for people? Who gets a ventilator? What are their chances? That's not where we are.
And that's why all these things are happening, to avoid that moment.
All right, Marshall, thank you.